But that word human is part of the story here. And we also need to recognize that we are human and that we work in systems and that the perfect outcome, the perfect process isn't fully on us, that we are part of it and that we can do our part and need to do our part, but that we are also a piece of a system that can be and is deeply flawed and that we can't take on entire responsibility for that system as well. So perfectionism is adaptive until it's maladaptive, and we need to be really mindful about where we fit on that spectrum.
Welcome to Success Reimagined. I am Dr. Amna Shabir, your host on this journey to thrive at the intersection of ambition and wellness. In every episode, I'll help you challenge outdated definitions of success, discover practical tools and strategies for growth without compromising your well-being. I am so glad you've joined me. Let's reimagine what's possible together. This episode contains discussion of suicide. Please take care while listening. If you or someone you know is struggling, call or text 988 for confidential support. Hello and welcome back, everyone. Today we have a very special guest, Dr. Stefanie Simmons. Dr. Simmons is the Chief Medical Officer of the Dr. Lorna Breen Heroes Foundation, where she leads national efforts to improve healthcare worker well-being and eliminate barriers to mental health care. A board-certified emergency medicine physician, she previously served as Vice President of Patient and Clinician Experience at Envision Physician Services, supporting over 26,000 clinicians. Dr. Simmons is a recognized thought leader in physician mental health, advocating for systemic changes such as removing stigmatizing mental health language from credentialing processes, and she continues to champion multiple initiatives that create healthier care environments for healthcare professionals. Welcome, Dr. Simmons.
Thank you so much, and I'm thrilled to be here.
So today we're going to dive directly into a conversation about perfectionism. And I would love to hear what perfectionism, this word, means to you. And do you identify as a perfectionist?
I think of perfectionism as a spectrum, and there's a certain spot along that spectrum that we all in healthcare need to inhabit in order to care for patients. So we want to check and double check our work. We want the very best care for our patients. And I've always said, please, like, if you're writing orders on my child in the ICU, like, I want you to be a perfectionist. I want things to be as perfect as humanly possible. But that word human is part of the story here. And we also need to recognize that we are human and that we work in systems and that the perfect outcome, the perfect process isn't fully on us, that we are part of it and that we can do our part and need to do our part, but that we are also a piece of a system that can be and is deeply flawed and that we can't take on entire responsibility for that system as well. So perfectionism is adaptive until it's maladaptive, and we need to be really mindful about where we fit on that spectrum.
It sounds like you're leaning towards this recognition that we want this healthy striving and we want to look for this excellence that is needed, but then also reminding ourselves that when it comes to those impossible standards and when we remove the word humanity from this equation, we really run into a lot of dangerous situations.
For sure. And I would also say there's a real danger in accepting responsibility for things you can't control. So when I think of perfectionism, I like to think of the spheres of influence. Like, what can you control? What can you influence? And what do you have to accept? And there are some things that are outside of our sphere of influence, much less control. And as a physician in my training, I always was trying to influence and impact my patients' health, right? Their choices, their outcomes. And sometimes, very rarely, those things were in my control. More often, they were in my ability to influence. But there were times where I just had to accept that something bad was going to happen to my patient, that they were going to make a choice that was bad for them, or that their disease process, their outcome was going to be negative, and I couldn't do anything about that. And so for me, how this interplays with perfectionism is a perfectionist has in the maladaptive sense, has an inflated idea of where their sphere of control is. So what can I control? A lot less than I think I can. May be able to influence quite a bit, but you can control very little. And that's where perfectionism to me can be maladaptive.
When did you have this really powerful insight? Because I want to absolutely reflect back what you said. A lot of our listeners are in their early career years and having this incredible recognition that there is my circle of influence and there's only so much that I can control. And here's how I'm going to show up. So take us back to that moment if you can.
Boy, I think there was a real gradual coming to this as opposed to a single moment, but I can think of a few signposts along the way. And I'm going to go like way in the way back machine here to high school, first of all,
Yes.
because I think, like many of your listeners, I was a really good student and also received a lot of validation from my good grades in even as far back in high school. And I chose in high school to take a study hall Mm. instead of another AP class as a senior and really step back from like, trying to be valedictorian, just doing the hardest of everything. And I had this concept of the grade to slack ratio, meaning you want to optimize your grades while also optimizing your slack, meaning your opportunity to do things outside of school. So that was my first moment where I was like, okay, I'm going to not try to do everything perfectly here. And then there was always this gradual pushback on I need to control everything academically. So in medical school, the form that took, I called myself a Krebs cycle conscientious objector. So as you know, like we have to learn it like 6 times. And my point was I'm going to learn what I need to learn to be able to identify disease and to address disease, right? And that's primarily like inborn errors of metabolism. So I'm like, okay, I'll know that, but I'm never going to learn how to write out the Krebs cycle. Conscientious objector. So just sort of holding that space for myself to say no. Now, that was in some ways a lot easier to do in the academic years. In the clinical years, that's where there's a lot more chaos and mess. And so I think I was first really introduced to this idea of influence and control as a student when I did an addiction recovery elective. I did 90 visits in 90 days with a cohort of patients who were going through substance use recovery, and I stayed with them for 30 days of mixed outpatient inpatient intensive treatment. And I'm sure you've heard the Serenity Prayer, as you know. And that was really this idea of change what you can change, accept what you can't, and know the difference. And I thought to myself, wow, this is really a lot of what I'm learning in medicine, like really having the courage to change things that are changeable, but then trying to develop that wisdom about what was the difference. So I would say that was a big inflection point. And I had some success and some failure doing that during my early career. I started coaching informally, little c coaching, my colleagues on patient experience and communication. And it was then that I realized this connection between how we interact with our patients and our own mindsets, and got very interested in that and did formal coach training. As part of formal coach training, you get a lot of coaching and you learn sort of how to be a thinking partner for others. And it was really during that process that this idea crystallized for me. Like a lot of where I can improve in my mindset is actually in understanding where I'm taking on responsibility for things that I don't have control over.
That is so powerful. And you mentioned the Serenity Prayer, and I laughed also in my own head because somebody gifted this to me when I was in sixth grade, and it was on my wall. The problem for me was I kept leaning into the courage to make a difference and
Yeah.
ignoring all of it. And it wasn't until like the last 2 years that I realized, well, can you just look at the whole concept and this recognition of how you're interacting with your patients and the mindset part of it. So, as you talked about this concept of influence and control, and you're helping your colleagues, you're coaching them, you're supporting them, and this concept is becoming more crystallized for you, was something like you just an example that comes potentially comes to mind where there was a colleague that you brought this concept to them and they were just so paralyzed by perfectionism. Like, for example, I'll notice it in the simplest of things sometimes where physicians are struggling with charting and they just don't close the note and it just continues to linger and linger. It's because it's never going to be good enough. But sometimes it can be something like very serious. Is there any story or thought that comes to your mind as I say that?
First of all, so many. And the reason I'm pausing is I'm thinking about what's one I can share. And so there's really two exemplars here that I think are worth sharing. And one is what happens when there's a natural or patient outcome, meaning someone comes in with a disease process and they die, they have a disability, a severe disability as a result of the process, and you weren't able to help. You weren't able to positively intervene. There's really sometimes a predilection to take that on in terms of responsibility. And I had a mentor early in my career share some words with me that were very helpful, which is that this was going to happen to this person, regardless of you. And all you can do is what you can do to help, but you can't fix everything for everybody, even though you may want to. And so there's this acceptance of, man, bad things are going to happen to people, even really good people. And that part you need to process and release. You need to be able to let it go. That's one example. And the other example is when something bad happens to a patient and it wasn't natural, right? Where there was an error or a missed opportunity for diagnosis or a misdiagnosis, or they fell through the cracks in terms of follow up. And some of these are individual error. Most of these are systems, faults. And what part we play in that and how we manage both our own expectations of ourselves and then also how we learn and grow from the experience. And so over the years, I've supported a number of people who have had a medical error, who are going through litigation, and that can be with a medical error or with just a bad outcome and no error. And the internal processing that healthcare workers and physicians go through when there's been a bad outcome and maybe something could have been different is so tumultuous and so painful a process. And part of it is that we always want everything to go perfectly for our patients. And it is hard to even conceive of the process of reconciling when it doesn't. But the fact is, every single person who practices will have a medical error. And it is only luck that determines A, whether there's patient harm with that error, and B, whether there's irreparable patient harm or litigation involved. And so it's something we all need to reckon with and manage. And there's another piece of this too, which is how does that play into your identity? What's your identity as a person, as a physician? And then how does this event impact that identity? Long answer to a short question, but
That
that's where I see this coming out most often. Yeah.
I really want everyone to go back and re-listen to what Dr. Simmons just said because that is what we all need to hear. It's like when you said that this is something we all have to reckon with, and it is so difficult. What worries me is that we're self-selecting. We know that. We're self-selecting perfectionists to go in medicine. We're all high achievers that come to this place and kind of moving off of what you just said. There is data that suggests that there is a link between perfectionism and suicide, and medicine self-selects these humans to go in these fields, and then we're taking care of human life and how we internalize and process all this. I would love to hear your thoughts on incorporating and addressing perfectionism in specific when we talk about suicide prevention plans.
Mm. The area I'm most qualified to speak on this is in the way that our institutions stigmatize humanness. So I'm trained as an emergency medicine physician, not as a psychiatrist. I'm not a suicidologist, but I have worked with many healthcare workers, heard from both individuals and the data about what impacts our ability to receive care and our thoughts about mental health care. And as you said, not only are we selecting for high achieving perfectionists to go into medicine and reinforcing those traits and tendencies as we develop professionalism in our training, for better and worse, because again, there's that spectrum of experience. But then we are eliminating even the suggestion that as a human being, you can have a flaw and need to receive care and still be a great physician through the types of questions that we ask on our medical licensing, nursing licensing, pharmacy, dentistry licensing questions and applications. And then also when we credential at a hospital or health center, we are asking, have you ever been diagnosed or treated for a mental health condition? As if that somehow invalidates you as a physician, as a healthcare worker. And these questions worded this way are really stigmatizing to humanness, not just to mental health care, but to humanness, because they seem to imply that if you've ever been diagnosed or treated for a mental health condition, that that is something that should be of concern in your practice of medicine, of your practice as a health worker in the future. When in fact, this is part of the human condition. We know about 20%, about 1 in 5 humans will be diagnosed and treated with a mental health condition in their lifetime. And there is nothing to indicate that health workers are exceptions to that statistic. In fact, there may be increased risk because of the risk factors of caring for other humans at their worst days and witnessing human traumas. So, what we're doing is we're saying, we are going to select you as somebody who's highly perfectionist. We're going to reinforce this, and then we're going to tell you repeatedly that if you ever need help, we're going to question your very identity as a physician. That's a setup for when you are a human, when you do need help. And by the way, this could be mental health help. It could also be physical health help. It could be parenting help. It could be relationship help. It could be tax help. Like we know that healthcare workers and particularly physicians are extra bad at asking for help in all of these areas and that has negative outcomes in our mental health, our physical health, our relationships, even our financial health. And so there needs to be a shift in how we talk about seeking help as not a weakness that is a fatal flaw to our very identity as physicians, but as what it is, which is a sign of strength and a recognition that the community has more wisdom than any one individual. That's not really how we are tested as we are evaluated or selected along the way. And it's something that we need to learn. And sometimes those lessons are very hard won or don't occur at all.
Absolutely. And I'm just going back to a moment in my life where hearing those words would have changed me completely. So I really hope that for anyone who is struggling today. And I love that you bring in just humanness, and it's not just medicine, it's everything. It's all of us together. I absolutely felt inherently broken when I had postpartum depression twice. The first time I was like, okay, let's just forget this is happening, sort of deal. And the second time it was worse. And I was so surprised that I thought I was mentally prepared. And I'm so grateful that you reflected it's all of it. It's not just medicine. It's all of it. It's just the humanness of it and being okay to ask for help.
Mhm. For me, as you've heard, I also experienced postpartum depression in residency. It was the first time I recognized how biochemical, right? Like mental health can be, because in my life, everything was going as planned, as I wanted it to be. And yet I still had this overwhelming sadness. And so, I mean, one time when I really experienced that feeling of, oh, I need help, but is it even okay? Is it even okay to ask for help? I mean, another time was just co parenting two young kids and trying to launch a career. And I didn't have a model of what that looked like. And image in my head that I needed to be doing all of the things myself: housekeeping, keeping a home, mothering, and physicianing. And I would add on top of that, like leading without help. And it was even to the extent of getting help in with housekeeping, for instance, that it was hard to say, I can't do this to the extent that I want it done without help, because that's not the way I had learned to get things done. I had learned to get things done by doing them myself. So these are the conversations now, as my oldest is starting her adulthood, that we're starting to have, is just, where can you get help? Because you actually can't do it all the time well. And sometimes you need to choose 2 of those 3 things, right? You can do it well some of the time, right? Or you can do multiple things well, or you can do it all of the time, but it's not gonna be any good. And I
Yes.
don't think any of us want to not do it well if we are parents, if we are caring for patients. It's okay if the dishes don't get done well. It's not okay if the parenting doesn't get done well, or the marriage doesn't get done well, or the patient care doesn't get done well. So you gotta trade off.
Nobody does it all. And really like leaning into asking for help. And there aren't leaders in your roles and, on the top, nobody talks about asking for help. Like the understanding is that she's doing it all on her own, or he's doing it all on their own. Or, the understanding is this, it's implicit. Do it all and don't ask for help, which is absolutely terrible. So I'm glad that you were able to draw attention to that.
And it's this is kind of like the social media phenomenon, where everyone's life looks way more put together on social media than it does in real life. So the leaders that I have gotten to know well, and this is everywhere from CEO to medical director, all the way across and within an organization. It's messy for everyone, and they have all found their own ways to make it work. But just like that great statement that it takes a village to raise a child, it also takes a village to manage a household and a career, even when children aren't part of the equation. So you need your team. And from time to time, people will say, like, oh man, you raised 3 kids and you have this career. Like, how'd you do it? And I was like, 2.5 additional FTEs. Like, so, how did I do it? Well, we had daycare. So that's an FTE right there of care for the kids. Help with the housework. There's part of an FTE. Help with the yard work. There's part of an FTE. And like, I recognize that it's a privileged financial position to be able to afford that help, but it's also a trade off of your time and your money. And so you need to think about, well, what do I actually want to be spending my money on? Is it, fancier things, or is it more time to do the things I really care about? And so for me, it was always more time.
And time is the thing that's not going to be replaced. I read it's one of those amazing Instagram posts that you have that your wallets will refill, but your time won't. So go do the thing that you want to do. I love that you brought not only attention to individual things that we need to focus on when we talk about perfectionism and accepting humanity, as well as the amazing work and the efforts that Dr. Lorna Breen Heroes Foundation is doing. And I'm so grateful to be an ambassador of that. All the efforts, the small efforts that I can do in terms of removing the hurdles for our healthcare workers to seek help. I would love to talk to you all day, Dr. Simmons, but I want to honor your time. So, for anyone listening who is paralyzed with perfectionism, who is stuck, who's not asking for help, what would you say to them?
First, that being perfect is a myth, that no one is out there doing it by themselves without help. It can be really helpful to hear others' stories. And so I encourage you to listen to this story, to listen to Dr. Carrie Cunningham's story, which probably link in your show notes or at least have a quick Google. You could find her. But also get to know some of your leaders and have a conversation with someone you really respect and know and hear their story. And what you will learn is there's really no one out there that is doing it on their own happily and successfully. Coaching can be a great resource to be a thinking partner through perfectionism and your relationship with it, as can therapy. And this has been a lifetime in the creating and doesn't get solved overnight. So if you think about your toolkit that you have, that you've accomplished, all the things you've accomplished in your life, it's a powerful toolkit, some powerful tools. Perfectionism is one of those tools. But if you use the same tool for every task in your life, something's going to break. So perfectionism is this hammer. It's great at hammering nails. If you use it to change a light bulb, you're going to be left in the dark. And so it's time to develop some new tools.
Oh, that was so beautiful. Thank you so much for your time today. I so appreciate you.
Thank you so much. I enjoyed the conversation.
I invite you to please visit Dr. Lorna Breen Heroes Foundation's homepage at drlornabreen.org and learn about ways you can support the healthcare workers in your community with only a few clicks. As of this recording, the foundation has already made it safer for 1.25 million licensed and 200,000 credentialed healthcare workers to seek mental health care. Your click counts. Thanks so much for spending time with me today. Just a quick reminder, while I am a physician, I'm not your physician, and nothing in this podcast is medical advice or any kind of professional advice. Everything shared here is based on my personal experiences, and the views expressed are entirely my own. If you enjoyed today's episode, I would love for you to rate, review, subscribe, and share the show with anyone who might need a little inspiration to redefine their own version of success. I'll see you next time. Until then, keep reimagining success one small step at a time.